Hi, welcome to the next video on healthcare communication skill series. In the last video, we have been talking about the documentation, communication skills through written communication. Now, in this video, we will explore the behavior of the doctor and the patient. In, in this video, we will emphasize that physician or a nurse is also an human being, and they also have emotional aspects of their behavior. They have anger, their stress management may be not good, or they are under stress, they have problems at home, they have issues around the work environment, they have problems with their superiors, they have conflicts with their juniors, or some other issues, financial issues, medical illnesses. In this, we should know how to handle the patient's complaints, how to handle the difficult patients, how to handle the conflicts with the patients, their attendants, colleagues, and how to handle the patients with the difficult behavior, whether in the outpatient department, whether in the inpatient department, and the different attitudes of the patient attendants. So we will explore in this how we can stay calm and stay professional while dealing with those emotional issues which we are having during our working hours or apart from our working hours, which we are bringing it to the place of work. So now we understand what is causing the conflicts. The conflict with the patient or complaint with the patient, every complaint has a source, every conflict has a source, and this source leads to complaints because the patients are in a different environment than the physician or the nurse. A physician or nurse daily comes to one kind of environment which we are accustomed to. We are professional and we are tuned to work in that kind of environment. Less drinking water, less eating, there is no entertainment around us sometimes. We are roaming around one ward to another ward, one work to another work, one task to another task, multiple medical reports, multiple patients, relatives, nurses asking doctors, doctors asking nurses. So we are tuned to this kind of environment. But when the patient comes in the unit, it is isolated. He or she is isolated in one of the rooms where he has or she has limited mobility. And on the top of it, if the patient is there, the patient is sick. He has fever, pain, or any other issues. Or if the relative is there, he has to take care of the person which normally he is not taking care. So there are burdens on his job description. So it leads to his stress, anxiety, and altered behavior, which is manifested in the resulted in complaints, conflicts, and those things which we are doing normally or which we are talking normally, he becomes angry on it because he is in not in the normal state of mind. For example, a patient is admitted. He is in pain. His relative is there with him or her. After few hours, nurse came. She gave the medication for pain and antibiotics or whatever the management is there. After few minutes, the patient is again complaining of pain and the relative wants to address that pain with the help of the healthcare staff. So he or she went out to fetch the nurse and see that what can be done, or if the physician is available, to bring the physician. Then she see or he sees outside the nurses or their colleagues are talking with fun, or they are not in a sad mood like the patient or their attendants, or they are not behaving in a depressed mood. They are peaceful, they are calm, they are talking to each other, sometimes laughing at something. So, because the patient and their attendants are in the stress mood and their mode is different than the mode of the person who is daily coming to the hospital, working in the same stressful environment, but the patient has come for few hours or few days. So they perceived that the people who are our caretakers are enjoying and we are suffering. Although it is not a right perception, but we have to address this issue wisely, because this is because of the frustration, unmet expectations, and fear. The fear is that my patient is going to be good or not, get well or not. Frustration is that there is a limited thing he can do for his relative, whether his wife or son or mother or brother or whatever is the relative. And unmet expectations that everybody expects that when they come to the hospital, whole of the hospital should be as anxious and as sad that the patient's attendants are. But because the physicians and nurses are tuned in the same environment day in and day out, they are doing the stressful work day in and day out, so they are accustomed to that kind of environment and they are not emotionally unstable most of the time. But whenever the patient complains of something or speaks rudely or asks for something, we have to listen before responding. Again, please take a moment, take a deep breath, count 1, 2, 3, 4, 5, release your adrenaline rush, and then respond to the patient. In this way, you can respond it in a better and wise way. So, in this way, we can acknowledge the emotion of the patient, and if we have behaved rudely in response to the patient, we can suddenly apologize in an appropriate way to the patient and make them realize that we know that they are in stress, they are in anxiety, they are depressed, but you are trying to help them to pass that period of anxiety. And you should give them some solutions how to counteract this kind of anxiety. So you have you have to respond in a wise way. So we have to focus on the issues, not the personalities. A patient comes in the ward and admitted. Their attendant came to the nurse or the physician asking for analgesia although the analgesic has given half an hour back. Instead of speaking rudely, instead of denying, just explain to them briefly and use the statements which are more favorable to their behavior. So, if you are not able to mediate it, ask the mediation for some other person. If you cannot handle the situation, involve some of your colleagues, some of your seniors, some of your staff, so that it will be easy to mediate or resolve the issues. So, if you are talking, you are responding, try to have a slower tone, speak slowly, simple words, give the space and time to the patient or their attendants to understand, to listen, and you should not use the defensive language. A patient is admitted to the ward and the relatives comes and asks why it is not there, why this thing is not present. There are two responses. Either it is not needed, second, it is not provided, we are not responsible for it. But there is a third wise way to give the solution. Okay, we are trying to get that thing, we are trying to establish all the pathways correctly, but sometimes some delay of management occurs because of the circumstances. So realize the patient and their relatives that there are loopholes sometimes which are not hazardous to the patient's care or patient's condition. If the patient is shouting or the patient attendant is shouting, so try to de-escalate the issues. Resolve this by involving your colleagues, your seniors, third party, or a person who are in common between them. Involve the people from the social service. But with this, the same thing which we have talked in the previous video, that document each and every event and analyze the situation, why the patient or their attendants are doing like this, and give your feedback to your colleagues for their training. In this way, you can give a better management for the patient instead of relying on the training which you have already done in the previous years. Each patient is a learning environment. Each patient provides a learning environment, and each patient is a book. So deal with each patient with empathy and calmness and try to diffuse the conflict. So every complaint is a learning opportunity. So try to analyze that problem, try to uh, give the solution for this, and try to implement the solution, and try to involve your colleagues so that this situation is handled in a better way than the previous ones. I am again thankful for you to give me attention. Stay tuned. We have another video on the same healthcare communication skills series. Thank you.